What orthodontic solutions do you offer adult patients?
I used to perform a lot of the orthodontics for my adult patients, and this goes back 35 or more years ago when orthodontists were trained in adolescent or child orthodontics. And there was a whole subspecialty of adult orthodontics. Adult orthodontics for aesthetic purposes, but there was another subspecialty. Adult orthodontics to solve disease problems and rehabilitation problems. And there were very few people in dentistry who had developed that expertise. And one of the places that had the largest collection of these people happened to be the University of Pennsylvania, which is where I trained. And I became rather fluent in orthodontic therapy for adult problems, and specifically for the management of gum disease and restorative dental prosthetic problems. There are many adult patients whose problems require a number of different disciplines of dental therapy: orthodontics, root canals, oral surgical jaw reconfiguring processes. And this is what I'm involved with for the most part in my practice. And since I've had such an extensive background, both personally performing orthodontics and overseeing orthodontics for these multidisciplinary type problems, I have particular expertise in guiding these treatments. A developing use of periodontal therapy, which has been actually developing for the past 15 to 20 years, is the use of periodontal surgical techniques to accelerate orthodontic treatment, reducing its time up to 2/3. In other words, cut the time to 1/3, start to finish of the case, but also to address a big problem. With three-dimensional x-rays, CAT scans, CTs, we can find out on patients if there are discrepancies in the width of their roots and the width of the bone of the jaw in which the root is invested. And for a lot of patients, their roots are larger than the bone, which means their sides are hanging outside. It's like too large a screw in the side of a board. Many of these patients in orthodontics as kids get what's called expansion therapy. Their teeth are crowded, so the orthodontist expands the arch in order to make room to uncrowd the teeth. And what's really happening is the teeth are being pushed way outside their bone support. 30 years later, you see it as advanced gum recession. 20 years later, 10 years later, I have a nephew that by the time he was 18, he had tremendous gum recession. At the time, we didn't have the technologies to determine what that problem was due to. Periodontal therapy has the ability to build bone where it's needed in order to move the teeth safely and keep them in bone. And there's a number of names for this. The two brothers, an orthodontist and a periodontist, who created it, the Wilco brothers, it's been termed Wilcodontics. There's also surgically facilitated orthodontic therapy, SFOT, which that acronym was coined by George Mandelaris in Chicago, because he's been on the lecture circuit for a few years now, pushing this. Another one, Colin Richmond from Atlanta, is on the lecture circuit pushing it as PAPA, pre-orthodontic periodontal augmentation. These techniques are wonderful, and the orthodontic community has not been fast in picking up on it. But like I predicted CTs 25, 30 years ago were going to become standard of care, this is going to become standard of care. It's very clear to me.